Welcome in, folks. It's time now for another edition of 8-1 for Your Health, sponsored by Penn State Health Medical Group. We are joined today by Dr. Marina Jeffery, who is a community and family medical physician at Penn State Health Medical Group. Dr. Jeffery, thank you so much for taking the time.
Thank you for having me, Jordan.
We kind of talked in this series about family doctors, personal family physicians. Why is it important to have a personal care physician in your life?
Absolutely. So there are so many reasons why it would be important to have a regular family physician. One is that it's really important to have yearly checkups. That's just to keep up with your general health, regardless of how old you are, basically to make sure that no serious health issues have kind of shown up. There are a lot of mental health things that are coming out of COVID, a lot of difficulty with medications and things like that. And seeing a family provider can help address those things either early on or to help you find different coping strategies or medical treatments. And then one of the really great things about seeing a family physician is we are exactly that, family physicians. So often we will have patients whose whole family come to see one person, which can be really great for coordinating scheduling, kind of seeing everybody in one day.
Yeah, growing up, I had a doctor that our parents had seen, and it was funny. I went to school with that doctor's granddaughter, and she's like, "Yeah, my grandpa's your doctor," and it kind of was a weird conversation. So, what are some of the health issues that people can get regularly checked on? I know the last time we spoke with Penn State Health, we talked about allergies and things like that. What are some of the things that people can see and get answers for from their family physician?
Absolutely. So I think allergies are a great one. You know, we're coming up on allergy season. Everyone is just going to be dealing with sniffles and itchy, watery eyes. I talked about mental health concerns. So things like ADD, ADHD, eating disorders, other mental health issues like depression and anxiety. Family health providers are usually credentialed in doing procedures. So if you have a mole that you need to have checked, or you have an abscess or something like that that needs to be drained, that's something that a family physician can take care of. Women's health needs can be taken care of by family physicians, such as PAPs and that sort of thing. Anything from diabetes, heart disease, weight management, asthma, all sorts of different things that your family medicine physician can help you wrangle.
And if you have a family physician, a family doctor, like let's say you get introduced to a friend, they go, "Oh yeah, this is so-and-so is a doctor." You don't have to ask that random person right there, "Can you look at this mole? Can you check this?" Because you have a family physician to do that for you.
Exactly. Yeah.
Do you get that a lot, by the way? People ask you like, "Hey, check this out. What do I have on my elbow?"
All the time.
Well, while I have you, no, I'm just kidding. So why, sometimes people, maybe they're not eating as healthy or not taking care of themselves, and they maybe have a fear of like, "Oh, I don't want to go see my doctor. They're gonna, tell me I'm doing things wrong." Why should those fears be thrown away? Why should people not be afraid to go talk to your doctor?
So Jordan, I think that our role, number one is do no harm. So our goal is to try to help our patients with their healthcare goals. And everyone is struggling right now in the COVID pandemic with regard to staying clean and healthy, keeping weight under control, exercising. It's hard for everybody. So, the Penn State Health, we're not judgmental about that. Our goal is to just help you. And we have lots of extra precautions in place to try to keep people safe with regard to this virus as well. So we implement masks in our offices. We have social distancing. We have increased cleaning procedures. We call it wash in, wash out, where we have to sanitize with each patient encounter. We also have virtual visits in the event that someone is particularly concerned about the laboratory concern. Lastly, there are everyone is kind of working 9 to 5, so it can be very difficult to see a family provider. Luckily, in our clinics, we do have extended hours as well as weekend hours. So we try to do that in an effort to not have your work be a barrier to your own.
Yeah, of course. I feel like sometimes it's a problem. And also, hey, you set up an appointment, we haven't really seen anybody in a while. Maybe you just want to check in with somebody that isn't just the person you've been quarantining with for the last
Ex-
month.
Yeah, it's been really nice to see faces, or I should say halves of faces.
Absolutely. Exactly. Dr. Jeffrey, I want to thank you so much for taking the time with us and giving us this information.
Well, thank you very much for having me. And, if there's anything else that anyone ever needs, please feel free to reach out to the Penn State Health offices.
That's right. And I actually have information on that. Folks, if you want more information on how you could set up a family doctor, personal physician, or any of those types of needs, you can visit pshcc.org/familymeddocs. Or if you want to check out all the different services that Penn State Health Medical Group offers, you can go to pshcc.org/care. Thanks again, Dr. Jeffrey.
Thank you so much. Have a great day.
Folks, we have much more still to come on the show today.